Hey there, fellow deep divers. Ever wonder why the U.S. seems so resistant?
To nationalized healthcare.
Yeah, when so many other developed nations kind of embrace it? That's exactly what we're diving into today.
Yeah, it's a question that touches on everything from history and politics to how we see ourselves as Americans.
Right, and we're going to unpack all of that using a fascinating academic paper.
As our guide.
Yeah, Why America Rejects Public Health Care: Propaganda, Profits, and the Price of Misinformation by Dr. Jaime Hoerricks.
Great source.
So whether you're gearing up for a debate or just curious about healthcare or maybe a little tired of all those confusing news sound bites,
This deep dive is for you.
this one's for you.
Absolutely. We'll be exploring how corporate interests shape the conversation,
Mm-hmm.
the real-life consequences of our current system,
Right,
and whether alternatives like a National Health Service or NHS
like they have in the UK.
exactly are truly viable, or just a scary socialist boogeyman some make them out to be.
Okay, so let's jump right into this.
Let's do it.
The paper starts with a pretty bold claim that America's resistance to a nationalized system isn't really about freedom or efficiency, but more about a profit-driven system protecting itself.
That's right. Dr. Hoerricks points the finger squarely at corporate-controlled media.
Okay.
Think about it. Cable news relies heavily on advertising from pharmaceutical companies and private insurers.
Mm-hmm.
So they have a vested interest in keeping the current system in place.
Okay, I see where you're going with this follow the money, right?
Yeah.
But how does that play out in real life? I mean, is it really that influential?
It absolutely can be.
Okay.
Think about the narratives you often hear about nationalized healthcare, like rationing, endless waiting lists, loss of personal choice.
Mm-hmm.
These images tap into very real anxieties, but they're often like selective examples
Okay.
designed to scare people away from considering alternatives.
So you're saying it's more about spin than substance?
That's a big part of the argument, and the paper gives a really compelling example.
Okay.
The NHS is frequently used to paint this scary picture. We often hear about the UK's NHS struggling with long wait times and staffing shortages.
Right. I've heard those criticisms.
Yeah.
But aren't some of them valid? Haven't we all heard horror stories?
Some of the criticisms have a basis in reality, but the key is context.
Okay.
The paper argues that decades of underfunding, largely due to neoliberal policies, have crippled the NHS.
Neoliberal policies. For those of us who don't speak fluent politics, what exactly does that mean?
Good point. In a nutshell, neoliberalism pushes the idea that less government involvement is always better,
Okay.
and that the free market can solve any problem.
Uh-huh.
Think trickle-down economics.
Yeah.
It's the ideology championed by leaders like Margaret Thatcher in the UK and Ronald Reagan in the US.
Ah, okay, that rings a bell. So basically you're saying that these policies, like the ones Thatcher championed, led to a systematic underfunding of the NHS.
Exactly. And it's important to note that this underfunding was often justified
Mm-hmm.
under the guise of making the system more efficient.
Okay.
But in reality, it created a self-fulfilling prophecy. Starve the beast, then point to its weakness as proof that the system is inherently flawed.
It's interesting because we see similar tactics used here in the U.S., for example, when politicians want to cut funding for public schools, they often point to failing schools as proof that the system is breaking.
That's a perfect parallel.
Yeah.
It's about creating a narrative that supports a specific agenda, even if the evidence doesn't quite back it up.
Yeah.
And when it comes to healthcare, the media plays a big role in perpetuating these narratives.
So it's like a carefully orchestrated PR campaign to make a nationalized system seem scarier than it actually is. And it's working.
That's a big part of the argument, but it's essential to remember the reality of the American system as it stands.
Okay.
Hoerricks doesn't shy away from that.
Hmm.
And you might be surprised to learn just how poorly we're doing compared to these scary nationalized systems.
Okay, well, now I'm definitely intrigued. Lay
Yeah.
it on me. What's the reality of healthcare in the U.S.?
Well, the paper paints a pretty stark picture when it comes to the financial burden of healthcare here in the U.S. Think exorbitant costs, premiums, deductibles, out-of-pocket expenses.
Right.
It's a lot to manage for even the savviest consumer.
Right. I think we can all relate to that feeling of dread when opening medical bills.
Yeah.
I remember when I had to get an NRI a few years back, and even with insurance, I was still on the hook for like $1,000.
Oof.
Yeah, it was not fun.
And what's even crazier is that we're already paying for healthcare through taxes,
Right.
which subsidize existing programs like Medicare and Medicaid.
Mm.
So you're essentially paying twice through taxes and directly out of your pocket.
That's a really good point. I hadn't thought about it like that. We're paying through the nose, but are we actually getting good value for our money?
That's where it gets really disheartening.
Okay.
The U.S. spends more per capita on healthcare than any other developed nation, but our outcomes are far worse.
What?
We have a lower life expectancy, higher infant mortality rates.
Oh, wow.
It's a pretty bleak picture.
Wait, are you saying that with all the money we spend, we're actually getting less healthy?
That's exactly what the data shows. And here's a statistic that might really surprise you. Medical debt is a leading cause of bankruptcy in the U.S.
Wow.
Think about that people are losing their homes and livelihoods because they got sick.
That's heartbreaking. And I know this isn't just theoretical. The paper tells the story of a woman with diabetes who had to ration her insulin because she couldn't afford the full dosage.
Yeah, that's just one example of the systemic consequences of a profit-driven healthcare model.
Right.
It's designed to extract wealth, not prioritize health.
Okay, so we've established that our current system is expensive, inefficient, and kind of terrifying to navigate.
Mm-hmm.
But where do we go from here? What are the alternatives?
Well, the paper dives deep into the potential of a National Health Service, or NHS. But before we get into the specifics, it's important to understand that an NHS isn't just Medicare for all.
Okay.
It's a completely different approach.
Okay, I'm listening. How is it different?
Think of it this way. Healthcare treated as a public good.
Okay.
Just like public education or roads, everyone has access regardless of their ability to pay.
So no more private insurance, no more confusing bills, just healthcare provided as a right.
Got it. It would be funded through progressive taxation, meaning those who can afford it contribute more.
That sounds great in theory, but wouldn't that be insanely expensive? How could we possibly afford that?
That's a common misconception. Remember, we're already spending an enormous amount on healthcare.
Yeah,
And much of it is wasted on administrative costs and corporate profits.
right.
Hoerricks argues that by cutting out those middlemen, an NHS could actually save money in the long run.
That makes sense. But are there any studies showing that this model could actually work in the U.S.? Our system seems so different and entrenched.
There are certainly challenges, but the paper points to existing NHS systems in the UK, Sweden, and Denmark as potential models.
Okay, but what about the wait times? We always hear about those long waits in countries with nationalized healthcare. Wouldn't that be a problem here too?
It's important to remember that those long wait times are often a direct result of chronic underfunding, not inherent flaws in the system itself.
You mean like the underfunding we talked about earlier with the UK's NHS?
Exactly. A well-funded NHS in the U.S. could potentially avoid those issues. Plus, if we compare wait times to what many Americans experience now, especially those without good insurance, it might not even be that different.
That's a really interesting point. I hadn't considered that. But what about the impact on doctors? I've heard people say that an NHS would take away their autonomy and force them to work for the government.
That's common concern, but Hoerricks addresses it head-on in the paper.
Okay, I'm all ears. What does the paper have to say about that?
Well, we'll dive into the specifics in a bit, but the core idea is that doctors in an NHS are still highly trained professionals who are fairly compensated for their work.
So it's not like they're being forced into some kind of medical gulag.
Not at all. The fundamental difference is simply the source of their paycheck. Instead of navigating the complex and often frustrating world of insurance companies, they would be paid directly by the government.
So in a way, they would be freed from the bureaucracy and could focus more on patient care.
That's one of the arguments. The paper suggests that an NHS could actually improve working conditions for doctors by reducing administrative burdens.
I can see how that would be appealing.
Yeah.
But let's be real. Building a functioning NHS in the U.S. wouldn't be easy.
Mm-hmm.
Where would we find enough qualified doctors and nurses to staff such a massive system?
That's a crucial question, and one that the paper doesn't shy away from.
Mm-hmm.
Hoerricks argues that a successful NHS would require a fundamental shift in how we approach higher education, especially when it comes to healthcare professionals.
You mean like making medical school more affordable?
It's more than just affordability, although that's a big part of it.
Okay.
It's about recognizing that investing in healthcare professionals is an investment in the health of the entire nation.
Okay, so we're talking about a significant cultural shift in how we view healthcare and the people who provide it.
Precisely.
Yeah.
And to understand the depth of that shift, we need to delve back into the historical context, specifically the influence of those neoliberal ideologies we touched on earlier.
Ah, yes. The legacy of Thatcher and Reagan. How did their policies shape the narrative around nationalized healthcare? And how did their ideas still linger today?
That's what we'll unpack next.
Okay.
It's a fascinating and perhaps a little unsettling story.
Well, then let's get to it. I'm ready to deep dive into part 2 of this conversation.
You know, when we talk about Thatcher's policies in the UK,
Mm-hmm.
it wasn't just about shrinking government as it's often portrayed.
Right.
It was much more about subtly changing the nature of the system itself, especially when it came to the NHS.
So you're saying she wasn't just trying to cut costs, but actually undermine the very foundation of a nationalized healthcare system.
Exactly.
Wow.
She introduced these internal markets within the NHS,
Okay.
supposedly to make it more efficient.
Uh-huh.
But what they really did was prioritize cost-cutting over patient care and fragment a system that was designed to work as a cohesive whole.
And at the same time, she's slashing public funding, which creates this constant sense of crisis.
Precisely.
That's
Classic
true.
starve the beast strategy.
Yeah.
And then, of course, the promised trickle-down economic benefits never really materialize, at least not for the average person. Meanwhile, corporations and private contractors swoop in to fill the gaps, profiting from a system that's been intentionally weakened.
It's almost like setting the NHS up to fail and then pointing to those failures as proof that a public system just can't work.
It's a cynical take,
Yeah.
but it's hard to argue with the results. And, you know, Reagan was singing from the same hymnal here in the U.S.
Right.
Slashing social programs, giving more power to corporations, all part of that broader neoliberal agenda.
And the paper argues that their legacy is still felt today in how we talk about nationalized healthcare here in the U.S.
Absolutely. Their influence continues to shape conservative resistance to any type of government involvement in healthcare.
Mm-hmm.
It's about deeply ingrained ideological beliefs about the role of government, individual responsibility, and even what it means to be an American.
It sounds like you're describing a whole worldview, one that sees any form of collective action, especially when it comes to social safety nets, as inherently suspect.
That's a great way to put it.
Yeah.
And the media, which is often influenced by those same corporate interests that benefit from these neoliberal policies, continue to echo those narratives. You hear commentators pointing to the problems in the UK's NHS as proof that all public healthcare systems are doomed to fail.
Right.
But they rarely mention the role that underfunding and privatization played in creating those very problems.
It's frustrating. It feels like we're stuck in this echo chamber where facts and evidence take a backseat to ideology and fear-mongering.
That's exactly why Dr. Hoerricks argues that changing minds about nationalized healthcare requires more than just presenting the facts.
Okay.
It's about reframing the entire debate.
Okay, I'm all for that.
Right.
But how do we do that?
Yeah.
How do we shift the narrative when it's so deeply entrenched?
Well, first, we have to combat the misinformation.
Okay.
We need to highlight the successes of nationalized systems worldwide, not just the cherry-picked failures.
Yeah.
We need to show people how well-funded systems in places like Scandinavia deliver high-quality care without bankrupting their citizens. Instead of just talking about it, we need to show concrete examples of how it works.
Show don't tell. I like it.
We need to shift the focus from individual costs to collective benefit.
Okay.
We need to start talking about healthcare as a public good, like education or infrastructure. It's an investment in a healthier, more productive society.
That's a great way to frame it.
Yeah.
It's not just about me and my healthcare, but about us and how we care for each other as a society.
Exactly. And we need to address the affordability myth head on.
Okay.
The truth is, the U.S. already spends more on healthcare than any other country.
Right.
We can afford a nationalized system. We're just choosing not to.
It's because those dollars are flowing to corporate profits instead of patient care, right?
Right. So it's not just a policy debate. It's a moral one. What kind of society do we want to live in? One that prioritizes profit over people, or one that ensures everyone has access to the care they need?
That's a powerful point. But I know there are still a lot of people out there who are deeply skeptical of any government involvement in healthcare. They see it as a slippery slope to socialism or even tyranny. How do we address those fears?
It's important to acknowledge those concerns and address them directly.
Okay.
Dr. Hoerricks dedicates a whole section of the paper to debunking one specific argument that's often used to scare people away from a national health service, or NHS.
Oh, I think I know what you're talking about.
Yeah.
The claim that an NHS would somehow enslave doctors.
You got it. It's a claim often championed by figures like Senator Rand Paul.
Right.
But as Hoerricks points out, it's a complete distortion of reality.
Okay, I'm ready to hear this debunked.
Yeah.
What's the truth about how doctors would function under an NHS?
Well, first of all, it's important to remember that doctors in an NHS are still salaried professionals.
Okay.
They're highly trained, respected, and fairly compensated for their work.
So it's not like they're being forced into some kind of medical gulag, right?
Not at all. The fundamental difference is simply the source of their paycheck. Instead of navigating the complex and often frustrating world of insurance companies, they're paid directly by the government.
Which arguably could free them up to focus more on patient care and less on paperwork.
Exactly. And the paper suggests that an NHS could actually improve working conditions for doctors by streamlining administrative tasks
Okay.
and reducing the influence of profit-driven motives in healthcare decisions. Think about it, instead of being beholden to insurance companies,
Right.
doctors could truly advocate for their patients' best interests.
That sounds like a dream come true for a lot of doctors. I know I've heard plenty of complaints about dealing with insurance companies.
Yeah.
But what about concerns that a government-run healthcare system would stifle innovation or lead to rationing of care? Are those valid concerns?
Those are legitimate concerns.
Yeah.
But Hoerricks argues that they're often based on misconceptions about how an NHS would actually function. For example, when it comes to innovation, it's important to remember that many medical innovations are already driven by government-funded research, not just private industry.
That's true. Look at the National Institutes of Health and all the groundbreaking work they do.
Exactly. And an NHS wouldn't eliminate private research or investment in new treatments, but it would shift the focus from profit-driven innovation to innovation that prioritizes public health needs.
So instead of developing expensive drugs for niche markets, we might see more investment in treatments for common but neglected diseases.
Precisely. And when it comes to rationing, it's crucial to remember that rationing already happens in the U.S.
Wait, really? But we're constantly told that socialized medicine equals rationing.
It's a scare tactic.
Okay.
Under our current system, access to care is already rationed, but it's rationed by your ability to pay. If you can't afford insurance or high out-of-pocket costs, you're effectively being rationed out of the system.
So it's not a question of if rationing happens, but who gets to decide how it happens and who gets left out?
Exactly. An NHS would aim to create a more equitable system of rationing based on medical need rather than financial status.
Okay, I'm starting to see the logic here.
Yeah.
But some people are always going to worry that a system like that would lead to lower quality care or longer wait times.
Yeah.
How do we address those concerns?
Again, we have to look at the evidence.
Okay.
Studies have consistently shown that countries with nationalized healthcare systems often have better overall health outcomes than the U.S.
Oh, interesting.
And as for wait times, while it's true that they can be an issue in some systems, especially those that have been chronically underfunded, a well-resourced NHS in the U.S. could potentially avoid those pitfalls.
So it's not so much a problem with the model itself, but with how it's implemented and funded.
Exactly.
Yeah.
And if you compare wait times to what many Americans experience now, especially those without good insurance, it might not even be that different.
That's a good point.
Yeah.
So we've debunked some of the common myths and fears surrounding a National Health Service or NHS.
Yeah.
But let's get back to the question of doctors. How would an NHS impact the medical profession itself, especially when it comes to training and recruitment?
This is where Hoerricks' argument gets really interesting.
Okay.
The paper suggests that a successful NHS would require a fundamental shift in how we approach higher education, particularly for healthcare professionals.
So making medical school more affordable? Is that where you're getting at?
It's more than just affordability, although that's a huge piece of the puzzle.
Yeah.
It's about recognizing that investing in the education of healthcare professionals is an investment in the health of the entire nation.
Okay, I'm starting to see the bigger picture here.
Yeah.
We're talking about a system where healthcare is truly seen as a public good, and that includes ensuring a well-trained and fairly compensated workforce.
Exactly. And by making medical education more accessible, we could attract a more diverse pool of talent, which would ultimately benefit everyone. We'd have fewer doctors saddled with mountains of debt and a healthcare system that better reflects the diversity of the population it serves.
It sounds like a win-win to me. But let's be realistic. How do we actually get there from here? How do we move from this entrenched system of profit-driven healthcare to a more equitable NHS-style model?
That's the million-dollar question.
Yeah.
And it's something we'll explore in more depth in the next part of our deep dive.
Okay, then let's not waste any time. I'm ready to tackle part 3. So we've talked about all the problems with our current system.
Right.
And explored the possibility of a National Health Service or NHS as an alternative.
Yeah.
But the big question remains, how do we actually get there? How do we move from a system that seems so entrenched
Just something.
to something that prioritizes people over profits?
That's the challenge, isn't it?
Yeah.
And there's no easy answer.
It feels overwhelming, to be honest.
I understand that feeling. Dr. Hoerricks acknowledges in the paper that it will require a massive shift in public perception, political will, and a willingness to challenge deeply ingrained ideologies.
So basically a cultural revolution when it comes to healthcare.
You could say that, But revolutions don't happen overnight.
Right.
They start with conversations with questioning assumptions and with educating ourselves and others about the possibilities.
And that's where this deep dive comes in, right?
Exactly. By understanding the forces that have shaped our current healthcare system, the flaws, the propaganda, the historical context, we can start to imagine a different future.
A future where healthcare is truly seen as a right, not a privilege, where doctors are free to focus on patient care, not profit margins, and where everyone, regardless of their income or zip code, has access to the care they need.
That's the vision.
Yeah.
And while it may seem daunting, it's important to remember that other countries have achieved it.
Right.
We're not talking about some utopian fantasy here, but a proven model that's working for millions of people around the world.
It's like Dr. Hoerricks says in the paper, the question isn't whether the U.S. can afford an NHS, but whether it can afford to continue with a system that's failing so many.
That's such a powerful point. We're pouring billions of dollars into a system that's inefficient, inequitable, and frankly, inhumane in many ways. Imagine what we could accomplish if those resources were directed toward a system that prioritized the health and well-being of all Americans.
It's almost too big to wrap my head around. But I think that's the takeaway from this deep dive. We have to start thinking bigger. We have to challenge those assumptions that we've been fed for decades and envision a healthcare system that's worthy of a nation that claims to value life, liberty, and the pursuit of happiness.
Well said. And remember, change starts with each of us.
So what can we do? Where do we go from here? It all feels so big and complicated.
It can feel that way, but there are things each of us can do.
Okay.
First and foremost, keep educating yourself. Don't stop with this deep dive. Dig into the research, explore different perspectives, and talk to people who have experienced healthcare systems in other countries. Don't let yourself be swayed by fear-mongering or misinformation.
So keep learning, keep questioning, and keep an open mind.
Exactly. And then talk to your friends, family, colleagues. Share what you've learned. Challenge those assumptions that have become so ingrained in our culture.
Start those uncomfortable conversations, even if they happen around the Thanksgiving dinner table.
That's right. Those conversations are how we start to shift the narrative.
Yeah.
And don't underestimate the power of individual action. Support organizations that are advocating for healthcare reform. Contact your elected officials and let them know this is an issue you care about. Vote for candidates who prioritize healthcare as a public good.
So many things we can do, both big and small.
Every voice matters in this fight. And remember, we're not just fighting for a policy change, we're fighting for a more just and compassionate society.
Well said. That's a powerful note to end on. So, dear listeners, we encourage you to continue exploring this topic, challenging your assumptions, and forming your own informed opinions.
And don't keep it to yourself.
Yeah.
Share this deep dive with someone who needs to hear it. Let's keep this conversation going because the health of our nation, both literally and figuratively, depends on it.
Until next time, fellow deep divers, stay curious and keep questioning the